Morning, everyone. It's Dr. Eric, the fitness physician. I'm all about hormonal fitness and muscle medicine, hormone optimization, and much more. So, continuing on my series, I always like to answer some questions from clients and patients, and kind of going back to the basics on a few things. So, we did a few Q&As about testosterone administration and forms. I had a few questions about that, so I thought I would clarify. So, basically, testosterone delivery methods. How do we give it? Obviously, there's many ways, and many people know some of this already, but probably the most common one, especially with my men, is injectables, right? We can do a subcutaneous injection versus intramuscular injection. There used to be intramuscular injections, in other words, deep in the muscle, in the thigh, butt, wherever, and that works just fine, and some people love it. However, you do have to oftentimes have to use a slightly bigger needle, go a little bit deeper, and there is some micro trauma to the muscle. So you're doing that week after week for years and years. That can add up. It can cause some scarring, some micro trauma to the tissues, which isn't always necessary. Subcutaneous injection is found to be just as efficacious, and you can use a smaller needle, and obviously you're going right into the subcu area, so much smaller damage and micro trauma to the tissue. And actually some studies have shown some better absorption and kind of a more delayed absorption because it's dissolving through the fat as opposed to through the muscle. Now some people say, oh well, what about it's going to convert into estrogen in the fat tissue? That's where fat makes estrogen, right? That's not always the case, and it really hasn't borne out in any studies. Yeah, if you've got a massive amount of fat, it may be an issue, but it may be an issue getting deep into the muscle if you got that much fat to lose anyway. However, the whole point of it with my programs is that, and with anybody who knows what they're doing, is they're going to treat them with lifestyle optimization, nutrition, and fitness. They're going to start getting rid of that fat anyway. And again, it's more of a hormonal bioidentical transformation anyway. It's not the kind that you get from your body's own production of estrogen, which isn't always a bad thing. Men need estrogen too. So basically, the bottom line is it doesn't happen, and it's not a big concern. Now, if you're having some weirder issue or some problems with that, there's ways around that. So personally, and my patients, they prefer the subQ. It's less painful, it's easier, much simpler to give, less trauma, and less roller coaster, right? Sometimes, especially guys who are doing huge doses of the IM, they get kind of like this roller coaster, right? Get big high levels and then a drop, and that's where a lot of the guys would have these complications or side effects, I should say, in terms of like their blood counts getting high. I always say they have to go donate blood because with their blood counts and they're on their what's called the CBC, the hemoglobin, the hematocrit, gets a little high enough to donate blood or get a therapeutic for phlebotomy. I've never really had to do it that in many patients because I dose them appropriately, and typically with sub-Q, it's not an issue, especially if you're doing smaller doses. I like to give more smaller doses frequently throughout the week, and it depends on the patient, it depends on their health, their metabolic markers, and some other things I see on the blood work and their lifestyle factors based on the history and physical exam that I might dose them maybe twice a week, 3 times a week, maybe even every day. It just depends, and there's certain ways to do it. There's nuances to it. So the bottom line is, with these big, huge injections, back in the day, used to give a big dose every 2 weeks, or even a big dose once a week. You get these roller coaster of levels. You get changes in your hemoglobin and hematocrit. You can get changes in your blood cholesterol markers, which kind of gave it a bad name, which again doesn't happen if you're dosing properly with sub-Q. Patches, not very user-friendly, so they aren't used very often. The trochees don't get very good levels as well, and a lot of people just don't like them. The oral form, though, especially the oral forms, could cause some liver issues, liver toxicity. Tends to not to be used very much at all. However, with women, we can use it, especially with older women who can't tolerate some of the other forms. It works pretty well, but with men, not so much an option. Creams and gels actually work really, really well. They used to be like an alcohol base, or now we have more of a Versa base or a lipoderm, and it's better absorbed through the fat and through the skin. You can use it on the skin of the thighs, the arms, and you can use it on a scrotal application, which actually works very, very well. Now, some people will say, yeah, I get more of a conversion into DHT and more side effects, but a lot of men actually like that because a lot of the androgenic effects you get is actually from the DHT, which is 10 times as potent as testosterone. So a lot of men like that. They like the extra boost in libido, sexual function, and energy compared to putting it somewhere else or doing the injectables. And other guys will say, yeah, well, what about it's going to make my hair fall out or my prostate get big? That's a discussion for another day, but again, that's not an issue typically with any of these forms because we've disproven the whole prostate thing. I'll talk about that later, but the hair is usually more genetically determined. If you are genetically determined to have early hair loss or alopecia, can it accelerate a little bit? Yeah, it can. But again, that's going to happen no matter what. So you got to decide what's more important. But again, it's usually not an issue, again, if you're dosing properly. Pellets are another nice form too. It's a little more invasive, of course, and there, of course, is the risk of scarring and microtrauma to the tissue, but you only have to do it every 3 to 4 months. I have a number of patients on that. I prefer always to start with the creams or the injectables, especially with a new patient. Maybe we'll transition to a pellet down the road, but I always prefer the other forms as opposed to pellets. But I get some patients that I inherited or came from another practice. They've been getting pellets. They swear by it and they love it and they want to continue it. I'm happy to do that with them. I'll go over the pros and the cons of it with the other modalities. And if they want to continue it, I'm fine with that as long as they understand the risks. But it works for a lot of people, especially from a convenience factor. But there is an issue and you have to be aware of that. So The last thing I want to touch on is commercial versus bioidentical. The commercial products like Testim and Axon, these other Androgel, some of these other ones, unfortunately, they just don't work very well. They're just not strong enough. They're only like 1%. Very low dose, and they're way more expensive. Sorry, Big Pharma, but it's just way more expensive. You're paying more for less. So typically, bioidentical is going to be much, much better if you use a quality compounded pharmacy, quality product. You get a higher concentration that's still within safe ranges and therapeutic ranges, but it's better purity, better quality, and it's bioidentical. Again, it's not the commercial grade. There's no synthetic forms. It's exactly like the form in our body, which is why it's bioidentical, right? Much better, much safer, works better. So, again, we were talking about the roller coaster with levels. I don't know if you can see this, but basically we want, say you want your levels in this range here, this black line, but if you're dosing too high or not frequently enough, you get this roller coaster effect, right? And that can happen with pellets too. It can go up and then after a while it starts to drop off, so you have to time it just right. Whereas if you're doing smaller doses or creams, you can actually, especially with the creams, you can really titrate and micro titrate on a daily basis. Keep those levels in a nice range, nice tight range. That's where you want. You don't want these crazy fluctuations. You want nice, smooth levels. So hope that that answers those questions about testosterone modes of delivery. If you have any questions about testosterone administration, hormone optimization, peptides, or anything else related, please reach out to me. I'm happy to answer any questions. Hope you enjoyed this video, and we'll talk to you soon. Check out my website, drericprimax.com. and learn more. A lot of free education on my Instagram, YouTube, and more, and products, a lot of which are free. So reach out to me, and everyone have a great day.